Hi everyone, I'm Yo-Yo. The topic I choose is will Ritalin increase the performance of working memory and what are the strengths and weaknesses of this assertion? I will talk about some definition which will help you to understand the following presentation. What is working memory? Working memory is a part of memory system that is used to control and operate the information held in our brain. Professors have discovered that attention deficit hyperactive disorder is common in children. ADHD symptoms include the defect of working memory, distraction, lack of self-control, and so on. A kind of medication, methylphenidate, known as Ritalin, has been used to treat this disorder. I will shorten the attention deficit hyperactive disorder as ADHD and methylphenidate as MPH in the following presentation. After reading several pieces of literature, three arguments have been made. First, Ritalin as an ADHD medication could increase the performance of behaviors and brain activation. In addition, Ritalin can be separated into acute and chronic, and these two kinds of MPH have different impacts on enhancing the performance of visual and verbal memory, while researchers didn't find it has any effects on working memory. However, the effects of Ritalin medication depends on the individual differences. The evidence has been found to illustrate that the highest dose of acute MPH 0.9 milligram per kilogram has the most effective enhancement, even though the effects are subtle and marginally. Also, taking too much MPH would cause side effects and decrease the effectiveness. It would have limitations that would result in less depth and comprehensiveness, and the researchers haven't discovered how MPH directly influence working memory. All the results and discussions mention that they predict the working memory has been improved. The argument I have collected from source one is in taking Ritalin can promote the behavioral responses and activation of the brain. The table below is from Cobo et al., showing a result table about the reaction times of tested behaviors, which represents the MPH-medicated children with ADHD perform better than the ADHD children without medicating MPH within 0 to 3 back test. Furthermore, MPH could act to inhibit the modulation of distracting, which could help children with ADHD be more concentrated and has faster behavior reactions. Let's look at the second image. This image is the imaging data. It shows the activation of occipital regions of the right hemisphere and the frontal and the parietal lobe parts of the left hemisphere. These parts are the regions that can control the verbal and visual ability. Cobo et al. Pointed out that these parts of the brain are more active if ADHD patients take MPH, and Meta claimed that the left hemisphere has more obvious activation than the right hemisphere. To summarize this evidence, we could draw that the MPH could increase the activation of the brain to enhance the working memory. The second argument is that acute and chronic MPH has different consequences of performance of visual memory. Roth et al. Tested groups of children with ADHD based on a simultaneous and delayed matching to sample task and pattern recognition task. Two graphs are shown here. For the graph B, this graph has demonstrated the percentage of correct responses under the delay time that ADHD patients with accurate response to MPH got. Roth et al. Pointed out that ADHD children with 0.6 milligram per kilogram MPH would represent a higher percentage of correct responses. And graph C explored the percentage of correct responses under the delay time that ADHD patients with chronic responses to MPH got. The result shows that under chronic conditions, medicated 0.6 milligram per kilogram MPH has a higher positive effect on performance. Obviously, ADHD patients who take the highest dosage of acute MPH have the most correct responses, and the effect is more pronounced than taking a lower dosage of MPH and placebo. However, it doesn't have significant differences of effect between the patients medicated 0.3 milligram per kilogram MPH and 0.6 milligram per kilogram MPH under chronic medication conditions. Also, taking 0.6 milligram per kilogram MPH under acute condition has a more significant effect than taking the same dosage MPH under chronic condition. Both acute MPH and chronic MPH have no effects on working memory. Experiment related to the test that impacts on bovine spongiform encephalopathy also shows no effects after taking MPH. The third argument I had made is the effect of taking Ritalin is related to individual differences. To be more specific, comorbid diagnoses need to be considered. The graph below illustrates the number of correct response that ADHD groups and ADHD with anxiety groups with different dose of medications gave. It demonstrated that MPH improved more performances on the children's PACE auditory serial addition task in non-anxiety ADHD groups than in ADHD comorbid anxiety groups. And the trend of ADHD with anxiety group is almost horizontal. Therefore, Tannock et al. Mentioned that MPH enhances the memory activities in only ADHD children, but there are no effects on anxious ADHD children group. Actually, ADHD children comorbid anxiety have less behavioral responses and weaker effects on the stimulant medications like MPH, and even no effects on working memory. Even though children are under similar weights, heights, or symptom conditions, the identical dose of MPH or other stimulant medication would not respond in the same effect for different patients. Consequently, the treatment of each patient might consider different, and the identical dosage might not adapt to every patient. It depends on inter- and inter-individual variations. Next is the evaluation of this evidence. For the first source, the action of MPH translate into this behavior improvement are still unclear, and the performances are enhanced marginally. For source 2, the sample of this study includes a group of children or adolescents that meet the criteria of International of Classification Diseases version 10 for hyperkinetic disorder. So the results may not be used to generalize about the children with diagnostic and statistical manual version 4 ADHD who don't meet the ICD-10 criteria for HD. But we could collect the information about the acute MPH effects more than chronic MPH. And the highest dose provides the most performance. In general, differences might present between current research and previous studies. Therefore, exploring the variations between diagnostic systems, professors need to discover ranges of subjects in the future to increase reliability and accuracy. Another thing that might affect the comprehensiveness is whether researchers have considered the side effects such as insomnia, stomachache, headache, diseases, and anxiousness, which could also decrease the performance of working memory. In conclusion, this plan is motivated by the observation of whether the Ritalin could increase the performance of the working memory. Actually, recent studies do not have directly evidence to clarify that Ritalin can increase the working memory, but the professors determined that Ritalin can enhance the working memory by exploring the improved performance of behavior responses, activations frontal and the parietal lobe part in brain, and visual and verbal memory. Moreover, the research indicated that ADHD children with the highest dose of acute MPH present a better performance than other ADHD children. However, current researchers also have limitations which would result in the conclusions being lack of comprehensiveness. The factors comprise individual differences and design of experiments. The last page is the reference list. That's all. Thank you.